Hi, my name is Professor Steve Fink, and this is the short video as an introduction to the subject of strokes and the use of blood thinners, where we go into much greater detail on the use of blood thinners and the various types. Let's take a look at the lecture outline. You might wish to print it out as a reference or when you watch the video so you can take notes. All right, so the subject of strokes, which are clinically called CVA, cerebrovascular accidents. Strokes are the third leading cause of death in both men and women. Heart attacks are number one cause of death. Cancer is the second leading cause of death, and strokes are the third leading cause of death. Commonly, strokes can be associated with unmanaged very high blood pressure, but it's also caused by blood clots and other causes as well. What we've listed next are the common symptoms, signs and symptoms that somebody is having a stroke, including severe headache, numbness of the face or arm, a sudden difficulty in speaking, or understanding what somebody else is saying, trouble with their vision in one or both eyes, dizziness, a loss of balance, and so on. After the age of 55, the chance of developing a stroke doubles every 10 years. We've given you some other information about the frequency of strokes in different populations. Now, on the second page is a chart that could serve as a way of assessing a patient with a neurological deficit, whether it's due to stroke or to dementia or some other problem, multiple sclerosis, MS, where you could assess their mobility, positioning for care, verbal interaction, visual interaction, whether they can open their mouth, how able they are to turn their head, and so on. You're probably already familiar with inventories or assessments similar to that. What follows next are oral health considerations. Again, the guidelines are similar to those after a patient has a heart attack, 3 to 6 months after a patient has had a stroke before they should have a dental visit. If they're taking warfarin, Coumadin, then you should check to see that their INR is 3.5 or less. Consult with their doctor. Again, just like with the case with cardiovascular diseases, if a patient is taking a blood thinner, an anticoagulant, they should not discontinue their taking the blood thinner for the dental appointment. And clinical symptoms sometimes include paralysis of the face, paralysis or flaccid tongue, and difficulty in swallowing as symptoms of having had a CVA, a stroke. Now, as we scroll down, there is a video that I've made. This was actually the video that was made when I gave a presentation for the LA Dental Hygiene Society, where we go into the use of blood thinners in a great deal of, greater detail. And here is the lecture outline that you can follow to follow the video. And again, you may want to print it out or not, and you can go through all that. And hopefully that will serve as a reminder, as a good review for the subject of blood thinners, very, very important one as a RDHAP. So we'll stop here, and we'll see you in the next video.